This is Dr. Roy Steinbock from Mindful Pediatrics, and I'm a board-certified pediatrician who has been integrating Western and holistic medicine for the last 15 years in my practice. This episode of House Calls with Dr. Roy, Quick Tips from Our House to Yours, is the third and final part of our three-part flu series. And in part one, I gave you the basic understanding of the flu and its potential risks and complications. In part two, I gave you the understanding you need to decide whether the flu shot is right for you and your family. And in this final episode, I'll be discussing basic flu prevention and treatment from both a Western and holistic perspective. So let's get started with prevention. To my patients, I sometimes feel like I sound like a broken record because the most important thing is to really maximize your child's basic health. And here are a few things you can do to keep your child healthy through the winter with some real basics. So the first thing I always like to mention is hand washing. We know that washing your hands for more than 20 seconds with soap and water has been proven to prevent influenza and many other infectious disease. And it seems so simple, but so many people just don't do it regularly or effectively. And though you don't need to go overboard, I do recommend washing your hands definitely before you put anything in your mouth, so eating. And specifically for children who tend to put their hands in their mouths very frequently, you might want to wash your hands a little bit more frequently. Our family also typically washes our hands when we return to the house from being outside. So kids from school or playing outside on the playground, or when we return from work or out shopping. And this really seems to make a huge difference. But sometimes hand sanitizer is actually a good idea as well. And if soap and water is an option, I typically don't use hand sanitizer, but they've actually shown that using hand sanitizer with more than 60% alcohol is actually more effective than washing your hands. And oftentimes this is really the only or best option when you're outside of the house. There are some natural brands which have less chemicals, but they do have the 60% alcohol, and the EO brand is the one we typically use at home and when we're out. Another really important thing is cleaning surfaces. So many viruses can actually hang out on surfaces for up to 2 weeks, especially things like influenza. They're quite resilient. And this is often overlooked. So at home, we typically use the natural disinfectants, things like 7th generation multi-surface cleaner. But if one of us is sick or in the office, we typically use something a little more intensive and a little more antiseptic, something like Cavi wipes or Clorox wipes, or even just rubbing alcohol is actually quite effective. And in addition to that, minimizing high-risk activities is really important. So things like traveling or dropping off your children at childcare, like the gym childcare or church or synagogue childcare. Those are just places where kids are going to be exposed. Also going to high-risk places like playground activities, indoor playgrounds in the winter, or things like the Children's Museum. Though they're fun, they typically are places where there's lots of little bugs hanging out on surfaces. And though I'm sure they make an effort to clean it, it's pretty difficult to keep up with the volume that's there. So so I recommend trying to avoid those things. A babysitter is a really good investment and will keep you a lot happier and keep your kids healthier throughout the winter. Another thing to do is to ask your playdates if they're sick. So when my daughter was an infant, my youngest daughter was an infant, my oldest daughter, who was 6, 7 at the time, had a playdate, and when they showed up at the door, this child was just coughing incessantly, and I unfortunately had to ask them to go back home, and it was kind of a bummer, but it was really important, especially to protect a young infant. So good thing to ask ahead of time. And in addition, keeping your kids home when they're sick. So, and this is a good thing for you as well. If you're ill, you should also stay home. First of all, this is how things spread. If you send your kids to school while they're sick, you can actually contribute to other kids getting sick. But in addition to that, we also know that you're much more likely to pick something up when you're sick because your immune system is preoccupied with either fighting something off or recovering from an illness, and it's not quite as strong as it normally is. So it's really important to get the rest. In addition to avoiding other people who are ill or exposure, it's also really important to get proper rest. So keeping your family rest is probably my favorite and most important thing I would say on this list. And I find that oftentimes, I have such a high exposure rate, but I find if I can just rest for a few nights when I'm feeling run down, oftentimes I can avert an illness that seems imminent at that time. So it's really, really important. And I've seen this with my children as well, and many of my clients as well. And last but not least, of course, is nutrition. So a good, well-rounded, whole foods diet is absolutely crucial. Things that you can start off with are eliminating sugar, dairy, or highly refined foods. And there's a lot of great information on our website. at mindfulfamilymedicine.com. And if you want a more personalized approach, my wife Debbie is an amazing nutritionist who could really guide you with that approach. Okay, so now I'm going to discuss some basic supplements and herbs that can be used for both prevention and treatment. And I'm going to break this up into 3 categories. The first category is going to be everyday essentials. And as I've already mentioned, I'm a big fan of starting with the basics. And we know that these everyday essentials are really things that just help maximize your immune system's ability to function properly and fight off infections and to help you recover more quickly. The basic essentials that I'm going to discuss have all been studied both individually and in conjunction and shown to decrease the number of times people get sick in a year. So really important. I'd start here. Vitamin D is really the first one. So vitamin D is the sunshine vitamin. Vitamin D is made by our interaction with our skin, cholesterol, and the sun. And it really takes the right angle of the earth and the sun. And we know that most places north of Southern California, you don't make vitamin D for a good portion of the year. Here in Colorado, where it's sunny in Boulder over 300 days a year, I've tested over hundreds of kids, and most of those kids have come back with insufficient levels of vitamin D. It's a really simple blood test that you can do, and I highly recommend coming in to discuss doing that or discussing that with your doctor, especially if you live north of Southern California. The basic dose for children is 400 to 1,000 international units per day. Here in Colorado, I recommend 1,000 for most kids. And for adults, it's typically 2,000 international units or more per day. And like I said, it's worth getting tested, because if you're low, you may need much higher levels than that. The second thing I recommend is probiotics. So probiotics, really, really important. They're literally called good bacteria. And we actually have 10 times as many good bacteria or probiotics in our gut than we do our own human cells. And it functions as really an integral part of our immune system. Also really important for things like digestion and many other functions in our body, but it is really, really important from keeping us from getting sick. And they've actually shown studies where probiotics alone can decrease the number of upper respiratory illnesses that you get in a year. So most people know about probiotics for digestive issues, but it can really help your respiratory and immune system as well. So I highly recommend getting a good quality probiotic and taking it really year long. Okay, in addition to that, I would recommend taking some omega-3s or essential fatty acids. So in nutrition, we call things essential when our bodies don't make them. So for example, we don't make omega-3s, fish do and certain nuts and plants do, but we don't. So we need to get them from our diet. And the other part of essential definition is that it's really essential or required for proper function. And every single cell in our body has omega-3s. We know them a lot from our brain, things like DHA, really important for infants. But the EPA is also really important for our brain and also for our immune system. So again, omega-3 is a great way to decrease inflammation and maximize your body's ability to fight off infections. And then the last one I'd recommend is a multivitamin. So a multivitamin is really just like a tiny insurance policy to make sure that what you're not getting from your diet, which really is where you should get most of your nutrients, you get the little extra from a multivitamin. So I think a good basic multivitamin is a nice way to just ensure that you're getting some of the nutrients that you might not be getting from your diet. The second category of herbs and supplements is going to be supplements and herbs for treating and preventing cold, specifically during cold and flu season. So these are things that you can use that actually help fight viral infection or help prevent viral infections. And some of them are professional grade products that you cannot find online easy, but we do carry them at Mindful Pediatrics, so you can always check with our office. So the first and most basic one is vitamin C. So this is a oldie but goodie. It's really one of the first things I used in my practice, and to be honest with you, it's still one of the more effective things. It's incredibly well tolerated. You can give it to very young children, and really the main side effect from too much vitamin C is loose stool. So you know you've taken too much if you start having diarrhea. So I would take vitamin C daily for prevention. And another thing you can do is zinc. So zinc is involved in thousands of chemical reactions in the body and is really an important cofactor for keeping you healthy. And I find that pretty much almost anybody who's getting sick really frequently tends to have low zinc levels. And you can get this tested as well. You can check red blood cell zinc levels. You don't want to just check a serum zinc because that's not incredibly accurate, but a red blood cell zinc level can tell you if you're low, and will also help guide how much to take in terms of zinc. But zinc can be an easy way to improve your immune system. Best if you take it with food, because for some people it can cause pretty wicked nausea. So I always recommend taking zinc with food. And then there's two supplements that I like to use in our office. One is called Vital Kids Berry Well Immune, and the other one is called Immunoberry Liquid. And these are both very similar. They're kind of herbals that have elderberry and a few other herbs in there, things like astragalus and arabinogalactan, isatis, some mushroom extracts, things like that, all kind of traditionally used herbs for kind of fortifying your immune system. So they don't necessarily boost your immune system, but they make your immune system more ready to fight infection. And in addition to that, I like a product from Xymogen. It's called Immunotix. I've talked about this one before. And this one is really, really excellent. It's a beta-glucan, and beta-glucans are kind of what we find in mushroom extracts. They're the things that kind of get your immune system primed to fight off offending foes. So really important. And I've actually taken this one on and off seasonally for many, many years, really like maybe almost 10 years at this point. And I find it's one of my secret weapons for staying healthy, of course, including all the basic things that I talked about earlier, which is where I start. Okay, so the third category of using supplements and herbs are really for when you actually get sick or you feel like you're coming down with something. And it's always best to start these right away because they're really most effective in the first couple days of an illness. Though they can help later on as well with severity, but they really can stop illnesses in their tracks if you get it early enough. And so the first thing I would do is just increase some of the doses of the things we discussed before, the vitamin C, potentially the zinc, the Berry Well Immune, Immunoberry Liquid, Immunotix. Those can all be used at higher doses and increased frequency and can really help fight off infections and improve symptoms. But for more specifics, I would use a product specifically for upper respiratory stuff. I like a product from Golden Flower. It's a Chinese herbal product called Clear and Release Chinese Herbal Formula. And this one's really great for kind of the runny nose, the cough, congestion, chest tightness, maybe even headache and sore throat. And it also has some direct antiviral fighting properties as well. And for kids who can swallow pills or adults, I like a product from Xymogen. It's called Viragraphis. And this is very similar to the Immunoberry Liquid and the Berry Well Immune, so kind of like direct antiviral herbs. So again, if you start that one early, it can be incredibly powerful. Specifically for the flu, there's a homeopathic called Oscillococcinum, which is really a mouthful, and I'm never fully sure if I'm saying it correctly. But Oscillococcinum has been shown in clinical trials to decrease the severity and duration of symptoms of influenza, and I believe it's also been studied for other cold viruses as well. And I've had good results using it for both colds and specifically for the flu, so really good natural anti-flu symptom relief. And I don't use a ton of homeopathy in my practice, but I've had really good success with this one personally and professionally. So there are so many options, and really oftentimes it's all about kind of the fine details and fine-tuning it. So if you have specific questions, I highly recommend you come into the office for an appointment, and I give this advice regularly, daily, with kids who are sick, and also for prevention in our office. Okay, so the last thing I wanted to talk about is how you treat and prevent influenza from a medical perspective, like a true Western medical perspective. And here there's not a whole lot. It's really supportive treatment. So, preventing respiratory distress and dehydration and all the things that are kind of basic common symptoms. So there's some symptom relief and symptom suppression from a Western perspective. And the other real basic thing, which I'm going to cover a little bit more in detail, is Tamiflu or antivirals. So these medications are used basically to stop the virus in its tracks. Now, how effective are they? So first of all, we know that just like the herbals I mentioned, they really need to be given in the first 48 hours of treatment, and otherwise they're actually pretty ineffective. And even at best, they only really decrease the symptoms for 1 to 2 days, though they actually can decrease the severity, which for some people is pretty important. Their effectiveness has been shown to be as low as 30 to 60% for treatment, but much higher for prevention, and this is where I tend to like to use it a little bit more. So if you've been exposed to someone with the flu, they've actually shown that it's up to 90% effective in terms of prevention. Now, we've discussed statistics before, and statistics can be very confusing, but let's just go with what they have here. In my practice, I do offer it to people, though most people end up not using it. And I usually recommend it a little bit more intensely for people who are high risk, like we've discussed in the first and really second video of this series. So go back to those to see who's high risk. And I'll give you a couple examples. So a few years ago, I had a family in my practice who had a newborn, and they had grandma staying with them and helping take care of the kids, and she got the flu. And the older child The older sibling got the flu as well, and the mom was starting to feel sick. So we tested everybody. They were all positive for the flu. The baby was not yet positive, the infant, and so we decided to treat her and really the rest of the family with Tamiflu as well, just considering what they had on their plate and the fact that they had an infant in the house. So it seemed high risk and made a lot of sense, and it made the family feel a lot better. And the infant did not end up getting influenza, which was excellent. And at that same year, really around the same time, my son Leo got the flu. And, because we're pretty much basically healthy and we spend a lot of energy focusing on the basics that I discussed earlier, we decided not to treat him or us for influenza. And really, within a few days, he was better, and none of us actually ended up getting it because we really worked on the basic prevention like I discussed. So, I really just like to give these examples to show you that there's different ways to do things, and that sometimes what might make sense for me might not make sense for you, depending on your risk or your child's risk. So, always good to get good advice from a good doctor who can help you make the decisions for yourself and your family. And though Tamiflu is actually generally considered safe, it does have a lot of side effects, and a lot of real common gastrointestinal side effects, I'd say, are the biggest ones I see people have issues with. And some of the rare side effects can actually be quite frightening, so you can look those up online. I won't go into those here. Okay, well, I hope you found this video helpful, and if you'd like to see more, you can find us on Facebook at Mindful Family Medicine, or you can look at our website or sign up for our newsletter at mindfulfamilymedicine.com. Be well.